Hi, my name is Ed Uthman. I'm a practicing physician. And I've been hearing a lot of ranting about healthcare reform in the last few weeks. And I'm just really frustrated, not so much by the people that are ranting, because they only know what they're told, and they're only reacting to things that they're told in the media. But what I'm really upset about is the apparent lack of any understanding by people in the media concerning the specifics of the topic of healthcare. To the point where many of the criticisms that are just totally off the wall, criticisms of healthcare reform, are not addressed at all by the mainstream media, even though they're blatantly false. Let's start with the first one, that the government would dictate details of healthcare if we were to pass reforms. I got news for everybody except people that work in the healthcare industry and know this all too well. The government already dictates every detail of everything we do. If you go to a hospital that accepts Medicare patients, even if you're not a Medicare patient, the rules that the government makes under Medicare also apply to you. Now, an average hospital has numerous full-time personnel, most of whom have advanced degrees, and all they do is work to comply with these rules and all the details. In addition, doctors such as myself and my colleagues will spend up to 10 hours a month in various committee meetings, and these committees are there to help physicians come into compliance with whatever rules the government has put out this month or this week. So putting the government in charge of all healthcare finance won't change anything in terms of the government dictating or not dictating details of healthcare. It's already there. Another criticism: the government can't do anything efficiently. This seems to always get a big round of applause in all the town hall meetings. But what the mainstream media never bring up, a fact that's well known, that Medicare is much more efficient than private insurance companies in terms of financing health care. The amount of overhead that Medicare takes off the top is minimal. It's minuscule compared to what insurance companies take. So again, this notion that the government is inefficient, maybe that may be true in some areas, but in health care, the government is the most efficient of all. How about Sarah Palin's death panels? This is nuts, and it's ridiculous that this is getting any airplay at all. Essentially, in even the weak bills that are being considered now by Congress, there's no talk of any death panels, of putting together panels of people to decide what patients should live and which ones should die. That's simply not part of it. What is a part of it is, at least one of the bills, is that provisions and financing should be made for end-of-life counseling. Now, end-of-life counseling is nothing radically new. In fact, when I was in med school over 30 years ago, people were extolling that was the end-of-life issues were the latest thing, and it was what we were all supposed to do and what doctors weren't doing enough of, and it's been preached all this time. And all of a sudden, Sarah Palin finds out about it because it's written in at least one draft law, and she goes berserk, and all of her followers in the mainstream media go berserk with her, and nobody takes her to task for that. Now let's talk about the notion of the choices you have with private insurance. Yeah, you can buy an insurance policy from any company you want to, as long as you don't have a pre-existing illness, or as long as your employer wants to deal with that insurance company. The bottom line is, not many people have the kind of choice to buy their own insurance. You can buy it on the free market, but people in the middle income scale simply can't afford it, and anything below middle is just out of sight. It can't be done. So you essentially have no freedom in terms of insurance. It's who you work for, whether they provide insurance for you or not. In fact, the only type of insurance you have where you get total choice is Medicare. In Medicare, there's no restriction on what is done for you in the hospital. Now, the hospital is restrained by how much they're paid. Based on your diagnosis, the hospital gets a flat fee called a DRG payment, diagnosis-related group payment. But whatever you and your doctor decide in terms of your treatment, as long as it's reasonable and not something crazy, it's going to be covered by Medicare. You'll get the treatment. Now let's talk about the criticism about health care being rationed. Again, so what's new? Health care is already rationed. It's just rationed irrationally now. There's no rhyme or reason behind it. Health care is basically a big opportunistic grab bag. Everybody grabs for what they can get, and some people just come up losers. This last week, and this is what stimulated me to get this off my chest, I had a patient who's in her mid-30s, just showed up in the ER with abdominal pain. And imaging studies were done, and it showed she had some masses in her liver. And the radiologist did a biopsy of that mass, and it shows a very malignant form of cancer. Now, it would be nice to know if this form of cancer that she has would be responsive to radiation or chemotherapy. But we're not going to know that because she doesn't have any insurance and there's nothing to cover her. So this life that may have been salvageable, that may have given 30 or 40 more years of useful life to her, is just kicked to the curb. Now that's rationing. If she happened to work for a large company that had a nice insurance coverage on their employees, then good for her, she'd be all covered and she'd get the royal treatment. But she threw snake eyes in that game. On the other hand, anybody that is lucky enough to make it to 65 and gets covered by Medicare, it doesn't make any difference how infirm you are. You come to the hospital, say you had a stroke 5 years ago and you haven't been able to speak or walk or feed yourself or give anybody any indication that you're even aware of anything. Again, if you're in the nursing home and your bed sores get infected or you spike a fever, you get hauled into the hospital by ambulance and you get everything you could need just to get you back to that state of persistent vegetative state and go back to the nursing home. Meanwhile, the 30-something-year-old person with cancer, it's tough luck for her. So again, I think this is probably just an academic argument. I don't really know why I'm doing this. It appears that the Congress people from both parties have been bought and paid for by various special interests. I see no evidence that we're going to have any type of meaningful healthcare reform this time, and maybe not in my life, but maybe if I go on record and other people go on record, and I would urge other physicians to do so too. Maybe things will change for the next generation. We can only hope.